Hello, everyone. Very good evening to all, and I am back again with another live session where I'm going to answer the questions that you have got related to your health. So, I am a physiotherapist and I have around 15 plus years of experience in helping patients suffering from various movement related disorders. So I run a YouTube channel where you are right now, which is HealthQ Rehab. And the idea behind running HealthQ Rehab is to help people, to motivate people, to inspire people to stay and lead a active lifestyle. So keeping that thing in mind, we have launched this YouTube channel and we create a lot of content around it. And the reason for doing this live interaction is also the same, where we can come forward and answer your questions. So feel free to type all the questions that you have got related to your health, and I will be taking those questions and I would love to answer them. So thank you so much for joining. I'm seeing people are joining slowly. फ्रेंड्स, आपको जो भी सवाल अपने पूछने हो, आप यहाँ पर अपने चैट रूम में अपने सवाल डाल सकते हैं। मैं उसको पढ़कर आपके सवालों के जवाब देने की कोशिश करूँगी। हम ये लाइव इंटरेक्शन जो है ये आधे घंटे के लिए रखेंगे और कोशिश करेंगे कि हम जितने हो सके उतने आपके सवालों के जवाब दे सकें। ओके, सो फ्रेंड्स, जब तक के हम लोग के सवाल आने शुरू होते हैं, क्यों ना हम कोई पॉइंट पर डिस्कशन करें। तो चलिए आज बात करते हैं हम नेक वर्टिगो की। जी हाँ, सर्वाइकोजेनिक वर्टिगो। अभी अक्सर ये होता है कि अगर हमें चक्कर आता है तो हमें लगता है हमें वर्टिगो है, पर ऐसा ज़रूरी नहीं होता। वर्टिगो होने के बहुत सारे कारण होते हैं। ओके, सो आई हैव सम क्वेश्चंस हियर। हाउ टू ट्रीट फ्रोजन शोल्डर। ओके, आप प्लीज एक चीज, वन मोर थिंग यू कैन डू इज इफ यू कैन जस्ट टाइप इन द चैट बॉक्स यू वुड लाइक मी टू आंसर इट इन इंग्लिश और हिंदी, I would take that language up and answer your question. Okay, so let me take it up in English itself so that all the audience will have some commonality. So, first, if you want to understand what is the treatment of frozen shoulder, we need to first know what exactly is frozen shoulder, right? So, as the name suggests, frozen shoulder, which means that due to some problem your shoulder, you are not able to move your hand up. Majorly moving hand out becomes a challenge. So this movement is something where there is a lot of difficulty the patient faces. You have to comb hair, you have to wear a cloth, or you have to bring your hands back. These are all the challenges that comes when you have frozen shoulder. This in medical terms is also called as adhesive capsulitis. What does this mean? That in our shoulder joint we have a layer that act as an shock absorber, and this is called as capsule. Okay, and when you say adhesive capsulitis, which means there is inflammation in that capsule, due to which the bones are not able to freely move between each other, and that leads to damage. Now, in order to treat, first thing you need to know that frozen shoulder takes time. Any of the condition, when you have to treat with physiotherapy, it takes time. It is something which will not be like a quick fix, like you take one or two session and it will go away. No, it will not happen. We work on frozen shoulder in three stages. Okay, so the first stage is called as your painful stage, or is the frozen stage. This is where your pain will be maximum and the limitation of movement and all will be comparatively okay. All right, so in this situation, the aim of the treatment is pain management, which is reducing the pain to an extent. Now, how do we reduce this pain? There are many methods to do that. The first method that we use is called as hot fermentation. Very simple. You must be having a hot water bag at home or else a electrical heating pad. Make sure you use that electrical heating pad 2 to 3 times in a day. When you use that electrical heating pack 2 to 3 times in a day, you are sending gentle heating That gentle heating increases the blood flow in that area. Due to that increase in the blood flow, the fluid, that accumulation of the, what do you say, the nociceptors, or the chemicals, the toxic substance, that gets flushed off. And as it gets flushed off, the flexibility of the muscle gets better, the muscle gets relaxed, and you feel better. So this is the first treatment. Apart from that, if you go to a physiotherapist, there are certain machines that we use. These machines are in the form of IFT, TENS, ultrasound. These are some name of these machines. So these machines help to reduce the pain. So this is what needs to be done. That's the second option. Third option, you can also go to an acupuncture therapist. Now acupuncturist, what they do, they use certain points, use certain points to press, and that pressing helps in reducing the symptoms. Now there are some advanced technique of pain management as well. For example, razor therapy is there, dry needling is there, cupping therapy is there. So there are different methods that are being used for pain management purpose altogether. But pain management alone is not the treatment of frozen shoulder. It's an incomplete treatment of frozen shoulder, because eventually the frozen shoulder will come back again. So once the pain is reduced by 40 to 50%, what we do next is we try to improve the movements in the shoulder. Now the problem is, when you have frozen shoulder, you won't be easily able to move your hand like this. You will be moving like this. So all starting from your shoulder blade bone, your movement starts developing, and we have to remove that. You should be able to freely move the hand, right? So how do we do that? That's where your manual mobilization methods come into the picture, where with the help of the hand we try to release certain knots, try to make the joint free. That's where our manual therapy comes. And you can also go to a chiropractor. They also do certain settings and all, and that helps in reducing your frozen shoulder. Now, apart from that, once that is being done, then we put you on an exercise program. It is very important that you have to continuously do exercise for your frozen shoulder. If you don't do that, your joint will not be free. And in the next stage of your frozen shoulder, it will become difficult for you to treat them. So, the idea is pain should be under control, the movement should be there, and your joint should be free enough to move. So these are the three things that is required to be worked on while treating a frozen shoulder, and that is how we treat frozen shoulder. I hope this answers your questions. आशा करती हूँ आपको ये आंसर समझ में आया। आई एम सो सॉरी, आपका नाम मैं पढ़ नहीं पा रही हूँ यहाँ पे। सिर्फ़ 4 टाइम्स आई लिखा हुआ है इसलिए, बट मैंने कोशिश करी आपको समझाने की फ्रोज़न शोल्डर क्या है। अगर आपको फ्रोज़न शोल्डर के रिलेटेड और भी कोई सवाल है तो प्लीज़ आप कमेंट सेक्शन में डालिए, मैं उसको आंसर करने की पूरी कोशिश करूँगी। और कोई सवाल आपको या आपके मन में है रिलेटेड टू फ्रोज़न शोल्डर या कोई भी तरीके का पेन, प्लीज़ आप टाइप कर सकते हो अपने कमेंट सेक्शन में। और मीनवाइल आपको ये भी बताना चाहूँगी कि हम लोग ऑनलाइन कंसल्टेशंस भी देते हैं। तो कई बार ऐसा होता है ना कि बहुत सारी चीज़ें ऐसी होती है हेल्थ रिलेटेड, जिसको हम बिल्कुल हाँ या ना में जवाब नहीं दे सकते। जैसे कई बार कई लोग सवाल पूछते हैं कि भई फ्रोज़न शोल्डर ठीक हो सकता है या नहीं? तो ऐसे नहीं होता है कि हाँ, ठीक हो ही सकता है या नहीं हो सकता, बहुत सारे फैक्टर्स पे डिपेंड करता है। तो हमें वो चेक करना होता है और उसके अकॉर्डिंग ही फिर ट्रीटमेंट होती है। और इसलिए ये बेस्ट होता है कि आप हमेशा किसी भी डॉक्टर के या थेरेपिस्ट के सुपरविज़न या गाइडेंस के अंदर काम करें, तो वो आपको ज़्यादा हेल्पफुल रहेगा। ओके, ऑलराइट, ठीक है। तो चलिए आगे बढ़ते हैं। हम कोई और टॉपिक पे भी सवाल ले सकते हैं। सो इफ एनीवन वाचिंग वीडियो राइट नाउ have any challenges in terms of frozen shoulder, tennis elbow, carpal tunnel syndrome, or back pain, neck pain, any of it, feel free to type it in the type box. Meanwhile, I'll continue talking about cervicogenic vertigo. चक्कर आना बहुत ही कॉमन प्रॉब्लम है। और हमें जब भी चक्कर आता है, कोई भी बोल देता है हाँ, आपको वर्टिगो होगा। लेकिन वर्टिगो आखिर है क्या? वर्टिगो क्या सबको होता है? ऐसा नहीं है। देखिए, वर्टिगो का जो डायग्नोसिस है, ये एक एक्सक्लूजन का डायग्नोसिस है। जब भी आपके कान में एक स्ट्रक्चर होता है जिसको कैल्शियम क्रिस्टल्स कहते हैं, जब वो अपनी जगह से हिल जाते हैं और वो जो कान के नीचे वाले हिस्से में जाके बैठ जाते हैं, और उसके वजह से जब आपको चक्कर आता है, तब उसे वर्टिगो कहा जाता है, जिसको बीपीपीवी भी कहते हैं। लेकिन अगर आपको बार-बार गर्दन में दर्द रहता है, अगर आपको बार-बार गर्दन में अकड़न जैसा महसूस होता है, इस तरीके के जब आपको सिम्पटम आ रहे होते हैं, तब हम उसे सर्वाइकोजेनिक वर्टिगो का नाम देते हैं, क्योंकि यहाँ पे जो आपको वर्टिगो हो रहा है, ये आपके नेक के प्रॉब्लम की वजह से हो रहा है, ठीक है? तो ये एक बिल्कुल ही अलग कंडीशन हो जाती है और इसका ट्रीटमेंट भी बिल्कुल ही अलग हो जाता है। मैं कई बार देखती हूँ कि जब डॉक्टर के पास जाते हैं तो वो बिल्कुल एक थमा देते हैं, एक चार्ट जैसा कुछ एक्सरसाइज का, वर्टिगो एक्सरसाइज के नाम पे। लेकिन वो एक्सरसाइज़ेज़ शायद आपको हेल्प कर पाएँगी, शायद नहीं भी हेल्प कर पाएँगी, ये बहुत ही जेनेरिक हो जाता है, राइट? तो ये बहुत ज़रूरी है कि हम इस चीज़ को समझें कि वर्टिगो क्यों हो रहा है? उसका डीप कॉज़ क्या है या कारण क्या है? और उसी के अकॉर्डिंग फिर हम ट्रीटमेंट को डिसाइड करते हैं। ये हो गया हमारे ट्रीटमेंट के बारे में। अगर अभी हम बात करते हैं वर्टिगो कब तक के ठीक होता है, कितना टाइम लगता है, तो ये भी डिपेंड करता है कि कितना समय लेगा वर्टिगो ठीक होने में। ये आपकी नेक पे आधार करता है। अगर आपके नेक मसल्स आप स्ट्रॉन्ग बना देते हो, अपनी ताकत अच्छी कर लेते हो नेक मसल की, तो ऑटोमैटिकली वो धीरे-धीरे सही हो जाएँगे और आपको वहाँ पे कोई भी तरीके का अ, जो सिम्पटम है वो नहीं रहेगा। लेकिन अगर आपके नेक मसल्स में वीकनेस ही बहुत ज़्यादा है, टाइटनेस बहुत ज़्यादा, तो वो ज़्यादा समय लेगा। तो इट डिपेंड्स, राइट? सो ओके, थैंक यू राजलक्ष्मी, आपका एक क्वेश्चन आया, माय नेक इज़ टाइट, प्लीज़ सजेस्ट। ओके, सो अगर इफ योर नेक इज़ टाइट, इफ यू फील stiffness around the neck, then you need to make sure that you do certain exercises. One simple exercise that I'll suggest you, that will reduce your neck stiffness very easily, is this simple. Do this chin tucks. One, two, three, four, five. ठीक है? So this is something that you can do. Next exercise, try to do a gentle neck movement. So when you do this gentle neck movement, what you're doing, you're trying to create some free mobility on your joint. It should not be painful. It should be gentle. Same way you can do slight gentle movement side to side like this. Same way you can do turning on the right and then bending down and up. Same way turning on the opposite side, bending up and down. Same way rotating the neck side to side like this. Don't do full circle, do half circle. So when you do this, do it for 15 days and you see the results. Your neck tightness will be reduced. Why? Because we have created some movements, free movements, pain free movements that will not allow tightness to develop. So I hope, Raj Lakshmi, this answers your question. Any other question related to neck stiffness? Anyone would like to take up? Any question? Okay, all right. अभी मैं एक किस्सा आपके साथ शेयर करना चाहूँगी, सर्वाइकोजेनिक वर्टिगो के रिलेटेड। मेरे पास एक लेडी आई थी, जो मेरी ही पेशेंट है। इनका जो जॉ अलाइनमेंट है, ये थोड़ा-सा अलग है, वो थोड़ा-सा चेंज हो चुका है, ठीक है? उसकी वजह से उनका जो नीचे वाला जॉ है, ये ऐसे है, लाइक उनका जॉ कई लोगों का होता है, जॉ आगे हो जाता है, राइट? अभी ये जब प्रॉब्लम थी, ये डेंटल ट्रीटमेंट से ठीक हो जाती है यूजुअली, लेकिन हम लोग इग्नोर करते हैं, हम उसको नहीं करते, वैसे ही उन्होंने भी नहीं करा है। अब ये लॉन्ग टर्म इसके वजह से बहुत सारा स्ट्रेन जो है, वो गालों पे पड़ता था, ठीक है? उसी की वजह से वो स्ट्रेन फिर नेक पे पड़ना शुरू हुआ। वही स्ट्रेन फिर अपर बैक पे आना शुरू हुआ, फिर वो लोअर बैक पे आना शुरू हुआ, फिर वो पैर में जाना शुरू हुआ। तो इस तरीके से धीरे-धीरे जब वो यंग थी तब कोई दिक्कत नहीं हुई, लेकिन जैसे-जैसे ऐज बढ़ती गई, ये दिक्कतें बढ़नी शुरू हुई और अब जाके यही सारी नेक की प्रॉब्लम वर्टिगो का कारण बन गई है और तब भी जब भी एक्सर्शन होता है, तब वर्टिगो के सिम्पटम्स आते हैं, यानी चक्कर आना फ़ील होता है, डिज़ीनेस आना फ़ील होता है और ऐसा फ़ील होता है कि जैसे अपर बैक में कुछ अटक गया है। This is the kind of symptom that comes when you have a cervicogenic vertigo. Majorly, cervicogenic vertigo happens due to imbalance in the muscles, and that's why we need to correct the balance back again. And the way we can correct the balance back again is very simple, and that is movement therapy. Make your movements your medicine. Yes, you heard me right. If you have pain, if you have any stiffness related issues, if you have anything related to your face, your neck, your upper back, lower back, try to bring rhythm in your movement. If you can bring rhythm in your movement, the movements will come back. You will be able to maintain your pain levels very low. You will be able to maintain your flexibility, you will be able to maintain your mobility, and you will be able to live a healthy and active lifestyle. So this is the key mantra for a healthy back or musculoskeletal system. Okay, so Rajalakshmi is asking, I had two surgery on my neck. Yes, Rajalakshmi, very much possible that surgery can increase your stiffness level, and that's why for you it is way more important to do gentle mobility exercises, because since you have surgeries, these muscles will be weak, and if you strengthen, it can put more strain on your surgery area, so that will not be a good idea. Stretching can also put more strain on your surgery area, so it's always better to do gentle movement, because that will be safe, it will not hurt your surgery area, and still that stiffness will go away. I hope this makes sense to you, Raj Lakshmi. And if you still feel that if you have any doubt and if you would like to take any of the consultation, feel free to reach out to us. We have a team of expert therapists. So I'm just putting our phone number. So this is our phone number. You can call on this number. Our clinic is open from 9 a.m. to 7 p.m. Monday to Saturday. So if you want to take online consultations, we do provide online consultations as well. Through online consultation, we will be able to connect with you via Google Meet call, and in that call, we'll do your assessment, we'll identify your challenges, and from there, we will try to help you out on how you can manage your pains and aches. We have also treated a lot of patients that's related to Bell's palsy. So if you have any questions related to that, feel free to write it down. Okay, Raj Lakshmi is asking, due to which my neck problem, I would like to have a teleconsultation with you. Sure, Raj Lakshmi, please call on this number. My team would be able to help you to set up a teleconsultation call with me, and I will be able to assess you and suggest you the best solution that you can have for your neck pain. All right. So, friends, this was about neck pain and neck related challenges. Also, follow us on our YouTube channel. We create a lot of content around pain, movement, exercises, and stuff like that. We have some free sessions that we conduct on exercises. These are regular free relaxation session which we give to people who have taken consultations from us, and this is like a regular sessions that we do free of cost for our patients. So anyone would like to avail that as well, feel free to reach out to us. We would be happy to help and connect. I hope, Raj Lakshmi, you have got this number. Please note this down: 960-640-2843. Call on this number and you would be able to set up an appointment. So, friends, thank you so much for joining in this live interaction. I will come back again next week on the Saturday, similar time. And if you have any of the doubt, feel free to put it in the comment section. Would love to hear them, and see you next week. Bye bye.